Well, the magic of POLST is that it goes across the entire continuum of care. So it gets all healthcare providers, from emergency responders to hospitals, nursing homes, all the way down to care provided in the home, thinking about and working to improve the way that we do advanced care planning in California.
I'm passionate about POLST because I've seen the nightmares that can occur when we don't know what a patient wants. We tend to overtreat and become very aggressive as patients become more ill, which translates to having them dying in an intensive care unit on a ventilator when maybe their wish was really to be at home with their family and their loved ones.
I think POLST is a great document because, first of all, it gets people talking about what their wishes are for the end of their lives so that they can kind of have it their way. And secondly, it's an actual order, so it's the kind of document that will follow them wherever they go, and it has to be followed. It's a doctor's order that's good across all care settings.
Well, POLST really gives an opportunity to bring it all into focus. You can have the advance directive. The POLST really gives you an opportunity to make sure that that's actually in order. It's something that's going to be followed. And I think what's better is it expands the discussion that an advance directive begins, and really gives a patient much more of an active role in deciding their future.
I think the biggest impact that POLST is having for patients and families is giving them the opportunity to dialogue in a very in-depth way about choices that are going to affect the ultimate outcome of their health care. As a nurse advocate, my passion is about empowering people to make good decisions and to have a good quality of life. And if I can facilitate that, then I will continue to do the best I can to keep people informed so that they make the right decisions for the right reasons.
POLST is a wonderful communication tool. It provides a framework for healthcare providers to initiate a conversation with patients to allow them to express their wishes for their end-of-life care. It allows patients to have conversations with their family members to discuss these issues and make sure that they know what their wishes are. Since it's a physician order, it ensures that patients' wishes will be honored across the spectrum of healthcare.
I'm passionate about POLST because it gives me that opportunity to talk with people before there's a crisis, to sort of let people's wishes be known to the whole medical community before we're in a situation where it becomes difficult to do that.
I'm passionate about the POLST because I've been a practicing palliative care physician for the last 16 years. And when I've discovered how elegant and how simple the POLST is to help capture my patients' wishes when they go through the system, the medical system with the coordination of care, it is there.
One of the biggest impacts that POLST has had is that the fact that it's not an all or nothing document, that it really is patient-focused, illness-focused, and symptom management focused. So we always know what to do when certain symptoms show up.
The biggest benefit that I see for POLST is that people actually do get to have some control at the end of their lives. You know, it's very difficult for people who are coming into a terminal situation to feel like they have control because everything feels out of control. And what this does, the POLST form gives them an opportunity to have a direct input into what happens at the end of their lives.
POLST benefits patients by allowing them the opportunity of bringing up a deep, painful subject that's on their mind, maybe submerged a little bit, but that's there causing them distress. And this allows us to bring it up and legitimize the discussion and to solve a lot of the worries and concerns.